Today, we will be discussing the Gait Speed test. The author is faculty at the University of North Dakota School of Medicine and Health Sciences and is a participant in the Geriatric Workforce Enhancement Program through Dakota Geriatrics. At the end of this activity, those who view the presentation will be able to describe what the Gait Speed test is and how to perform it. They will be able to interpret the findings of the Gait Speed test and be more comfortable determining who might benefit from therapy or use of an assistive device. The Gait Speed test assesses walking ability and mobility. It is a simple and yet reliable tool that measures walking speed and gives us information on mobility in our older adults, or individuals with neurologic conditions, or those recovering from surgery. Walking speed is considered a key indicator of health, and it correlates well with overall functional status and prognosis. The Gait Speed test, or GST, is a test that measures the time it takes to walk a specific distance, which is usually 4 meters or 13 feet. Variations on this are possible and will be discussed later. Why does this matter? In terms of functional independence, the slower the gait speed, the higher the risk of disability. Also, slower walking speeds are linked to increased risk for mortality in older adults, and as a health status indicator, it reflects the individual's overall physical health and mobility. To set up the test, you need to find a flat, non-slippery area without obstacles to set up the test. This could be a hallway or an open area in a gym or therapy center. The typical path distance is 4 meters or 13 feet. This should be marked off, and the participant should be instructed to walk at their usual comfortable pace. They do not need to hurry but walk as naturally as possible. You can allow a brief warm-up. To perform the test, position the patient at the starting line, 0-meter mark. Instruct them to walk as quickly as possible without running. As soon as they begin walking, start the timer, and stop the timer once they cross the 4-meter mark. Record the time in seconds. For accuracy, it is recommended that you perform the test twice and use the average time. If they use an aid for walking, they can still perform the test, but it should be noted that they were using a walking aid. The Gait Speed test also has some variations. A common variation is to perform the test over an 8-meter course, with the first 2 meters being an acceleration zone, and the last 2 meters being a deceleration zone, and the timing starts at the 2-meter mark and stops at the 6-meter mark. For healthy older adults, the gait speed is about 1.2 to 1.4 meters per second. If the gait speed is greater than 1.0 meters per second, it usually indicates some independence in mobility and daily functioning. If the gait speed is less than 0.8 meters per second, there is an increased risk for functional decline and fall risk, and less than 0.6 meters per second suggests a high risk for frailty and disability. In terms of significance, slower gait speed is a predictor of falls in older adults. Walking speed correlates with the ability to perform daily activities, such as dressing, cooking, and cleaning. Gait speed also serves as a predictor of cognitive decline in older adults. There are factors that can affect gait speed. Obviously, age can affect gait speed, as well as diseases that impair ambulation, such as a stroke or Parkinson's disease, and even arthritis can slow gait speed. Cognitive impairment can slow walking speed, and environmental factors such as slippery floors, uneven surfaces, or poor lighting, or even problems with hearing can be a factor in terms of decreased walking speed. Also, if our patient is fatigued, it can negatively affect walking speed. There are some common variations of the Gait Speed test. One that uses the same 4 meters to time, with an acceleration of 2 meters before steering the timer and a deceleration of 2 meters after stopping the timer, as depicted previously. But there is also a 10-meter walk test, and a community ambulation test that is carried out in a more natural walking environment. The link here shows an example of the Gait Speed test being administered. So, in summary, the Gait Speed test is a simple test that can be done in the clinic that can help us assess our patient's mobility and function and give us data that may help us predict fall risk. A normal gait speed test is 1.2 to 1.4 meters per second, and speeds less than 1 meter per second may be a problem with those who are less than 0.8 meters per second, indicating an increased fall risk and functional decline, and less than 0.6 meters per second suggests a high risk for frailty and disability. The test is widely used in clinical practice and gives us valuable information on our patient's physical health status. In conclusion, gait speed is powerful predictors of health outcomes in older adults, and its measurement should be part of our routine clinical assessment. Here are the references for these slides as generated by ChatGPT AI and edited by me. Thanks for your attention and have a great day.